Today we're going to be learning manual lymphatic massage. This is a basic massage technique by the Vater Institute. You start at position 1. Position 1 is the deep cervical nodes, working to the posterior cervical nodes. You work down at collarbone, work up towards the neck, including sides of neck, up towards ear and jawline 3 times. You'll notice that I am doing a 3 pulsating movement at each node chain. This allows for you to be able to manipulate those nodes full of impaction and allow them to drain properly. Your second technique is going to involve working downwards in front of the ears, and you are going to be pumping those node chains 3 times. Let me see here. So at this time, you're going to be working the parotid gland as well as the post-auricular nodes, and then following down into the anterior cervical nodes, following down the posterior cervical nodes chain deep into the deep cervical nodes. Your third technique begins by working outwards and downwards from the chin to the ears across the jawline 3 times. You're going to be working the submandibular nodes. These are 3 nodes placed underneath the jawline, as well as the submental nodes located at the inferior position of the chin along the platissimus muscle just below the mentalis muscle. And then you are going to be starting back at your anterior cervical nodes, working downwards to the posterior cervical nodes, and then into the deep cervical nodes, following that deep cervical chain. You will notice that all of these movements are performed 3 times. The pumping of the nodules allows for proper impaction release, bringing along the jawline into that cervical chain, starting at the anterior cervical nodes and working all the way down to the posterior cervical nodes and to the deep cervical node chain. Now you're going to be working outwards and downwards from the from the lower lip all the way in along that mandibular jawline, along the mentalis muscle, flowing back to the cervical chains, starting at the anterior cervical nodes to the posterior cervical nodes and to the deep cervical nodes. Following this chain, releasing into what is in layman's term the dump along the supraclavicular fossa. Manual lymph drainage is a technique that I enjoy because it allows me to reduce inflammation, partially related to sinus issues. It does bring sculpting. It does help with fine lines and wrinkles. Your fourth point is going to be working outwards and downwards from the upper lip, under the nostrils to the ears. Once again, you're going to be releasing all of this lymphatic congestion into that cervical chain. So you're going to be pumping this time from your 4th position. These are simply known as your facial nodes. You have 3 points in your facial nodes. This is going to be working at facial node 2. and you're going to be bringing that to the postauricular nodes and down into the anterior cervical nodes, following to that posterior cervical node and down into the deep cervical node, known as the deep cervical chain, pumping and releasing all the way through to that supraclavicular fossa, the dump. It is very common when clients receive any type of lymphatic massage, especially located in the facial portion or the facial region of your client. They're going to notice some drainage falling from the back of their throat. They may notice that they need to cough. This kind of reminds me of like when you are having allergies and you're constantly feeling that drainage in the back of your throat. And feeling that real need to clear your throat from the drainage. This just means that your technique is effective and your client is going to be receiving results. Another reason why I really enjoy working with manual lymphatic drainage and these massage modality techniques is it does help reduce inflammation, also due to stress, which helps with releasing migraines. Now we're going to be working at the fifth position. The fifth position is your third facial node, and you're going to be once again releasing into that post-auricular node, down into the anterior cervical nodes, following to the posterior cervical nodes, and then leading lastly down that deep cervical chain into the deep cervical node, and releasing and dumping into that supraclavicular fossa. When you are going to be working the inferior portion of your client's face, you will always be dumping into that supraclavicular fossa. This is because of the ley lines of the nodes located in the face. I've included a diagram for better absorption and understanding on how the ley lines of the lymphatic mapping is within the face and in the neck. You notice that I'm moving very fluid and very slow and taking my time. If I was to be working on a traditional client versus a mannequin head, I would be feeling with the tips of my fingers to understand what I'm exactly feeling underneath the client's skin. When a client does have some impaction along those lymphatic nodes, you're going to feel a mucousy membrane texture underneath that skin, and you're going to feel yourself moving it. This is a very deep, light touch. Deep is what I mean by deep is that you're going to be concentrating. It's very detail oriented. You're going to be paying specific attention. This isn't a flow that you should memorize and just walk away with a technique and do blindfolded. It's very important for you to remain attentive and really focusing on what you're feeling to make sure that you give your client the best results. When you do not apply manual lymphatic massage technique correctly, your client can walk away disoriented. They can walk away unbalanced. They can walk away with migraines. They can walk away with auricular migraines, meaning headaches behind the eyes. On your sixth position, which I'm demonstrating now, you're going to be working outwards and downwards from the inner eye along your nose to the ears. So these are called pre-auricular nodes. And these preocular nodes pump down into the parotid gland as well as the post-auricular nodes, leading into that anterior cervical node and following that cervical chain into the posterior cervical node, into the deep cervical nodes, and then following into that supraclavicular fossa. This is absolutely great for sinus relief. It is a technique that I incorporate in all of my massage and facials. I especially love getting into those nodes along the nose. You can feel a real benefit from that very quickly. As I was just describing earlier, that symptom of feeling that drainage in the back of your throat and that need to cough is very possible just by doing the simple facial node techniques along those preauricular nodes and then to that parotid gland, as well as following into that deep cervical chain. If you notice in this technique that I'm coming to the more superior aspect of the ear, this is simply because of the ley line of your lymphatic ducts. So when you are getting to the nasalis portion, working around the nose and below the eyes, all of those ducts are going to drain into and near around the parotid gland and the post-auricular gland. So you anything superior to the upper lip portion is going to be first dumping at the superior portion of the client's ear, and then down to the inferior portion of the client's ear, and then wrapping your finger slightly around and at the inferior portion of the client's ear around the neck. So this technique right here is technique 7. Technique 7 is going to be draining the eyes. So what you're going to do is you're going to use your full hand, fingertips on the temples, on the sides of the face, to pump outwards and downwards. This is great for stress reduction. It's great for people that hold stress and tension in the aponeurosis of their scalp. It's going to allow the client to feel that relaxation along the forehead and into the corrugator muscle. For people that are very expressive with their language in a physical sense, this is something that's very, very beneficial for them, working along into that forehead and along those eyebrows and releasing them to that corrugator portion. If you notice that I started at the midline of the eyebrow and then I'm working more into the temples, this is so that I make sure that I am draining correctly and I am allowing for no lymphatic buildup, because what is common for people that do not understand the technique is to make sure that though you are doing all of these steps, but to really feel the client's face or body part wherever you're working, and understanding that we are moving the lymph. And yes, any massage movement is going to move the lymph, but this is a gentle technique. It is a purposeful technique, and it is a technique that we use many times for cancer patients. So people that are suffering from cancer, how we diminish cancer becoming metastasized and alleviating the client through many type of therapies. They will then lean on post-cancer with lymphatic massage. So what the care team does is that they take the lymphatic nodes from the region where there is a cancerous tumor or cancerous abscess or cancerous lesion, and that, along with your other medical modalities such as radiation and chemotherapy, and sometimes recession shots that help decrease the capacity of how quickly the cancer moves. This is going to help drain them, because when we are taking away those nodes, their body is no longer able to drain properly in that area, and that's what causes masses such as lymphedema. And so this is very important for medical purposes, as well as the benefits of all the fine things that we enjoy as an esthetician, like the removal of fine lines and wrinkles, as well as contour and sculpting, and just giving a natural lift. Though those benefits are only seen for a few hours, that's kind of a nice way to just letting your client leave the room feeling transformed, because many times addressing client skin concerns are going to take several treatments. And so this is kind of one of those firstly gratifying treatments that we can offer our clients, is for them to walk out feeling more sculpted and more toned. And so a neat little trick. Everybody enjoys it. It's a very, very beautiful feeling. And it really does help with migraines. It does really help with auricular headaches. It does really help with tension and buildup within the face. This is a great pre-service to people that are going to be receiving any type of buccal massage or temporomandibular joint massage, everybody knows the abbreviated term is TMJ. So now we're going to be placing, excuse me. So we're going to be tracing along those eyes once again, following into that parotid gland to the posterauricular nodes and anterior cervical nodes down to that deep cervical chain along the posterior cervical nodes and the deep cervical nodes into the supraclavicular fossa. Once again, you notice that my movements are intentional. You will notice that my movements have meaning, that I am focused, that I am paying attention, that my movements are consistent. I'm taking my time. I am assuming that this mannequin head is just like a true client on my table. I am trying to pay attention to everything that I'm feeling. I am trying to bring beauty into it. I have purpose into it. My intent is there. So this is be placing technique 9, and technique 9 is involving releasing that deep epineuritis scalp along the frontalis muscles, working into the temporalis muscles and along into the occipital ridge and into that working down the neck and then pumping. So you're going to notice that I'm coming back to temple placement. What I'm really focusing on right here is that parotid gland. I'm going to be bringing it around. This is a beautiful dump area that is commonly missed, which is why everybody, if you notice, when you are using any type of massage technique or modality and you are massaging in and around those ears, they're like, oh my gosh, that's so amazing. It is somewhere that is very commonly neglected, and so there is a lot of lymphatic buildup there. So it's very important to focus on. If you ever hear your clients talking about feeling like as if they have some type of vertigo or they're having fluid retention in the ears, this is a superficial way to work into that periocular area. The technical term for it is external audio meatus. Now we're going to be doing technique 10, which is placing the full hand on the forehead, palms over temples, and pumping outwards and downwards. This is a more broader technique. I'm working along the sagittal suture, the coronal suture, allowing for movement. When we're releasing the epineuritis of the scalp, this allows for natural lymphatic drainage. So it's really important to touch the client's facial region as a whole. And the reason why we include scalp therapy or manipulation of scalp when we are working the face is because if we are not releasing all of the muscles around the face, it's called working satellite. If we don't focus on working satellite, we are not going to be able to remove anything into that radius. So knowledge about massage right there. So if you ever feel a client with some type of adhesions or musculature disformations or abnormalities, it's really important to focus on working satellite around that area. So working in a broad area around where you are noticing any type of abnormalities or tension, hypertonicity, and then moving, progressing inwards into that radial aspect and attacking that issue once you released everything around it. Otherwise, you're going to be working at that area forever and nothing's going to be able to release. You can think of that as having a necklace that is knotted up. And when that necklace is knotted up, you don't start in the middle of the necklace and try to get that broken out. You try to work around the loosest part of the knot and slowly work into that deep knot before you can finally release the necklace. Because you're not going to be able to break it up simply. It's just simple analogy. I'm really focusing on that external audio meatus, making sure that it is draining properly down into that cervical chain, into that anterior cervical node, posterior cervical node, and deep cervical node, draining it all once again into that supraclavicular fossa. If you notice, I'm doing this technique a couple of times because the working along the aponeurosis is far less superficial than the chains along the facial portion. And this is simply because our skin is very different along the aponeurosis of our scalp versus the frontal portion or the most prone portion of our face. So I'm really focusing along that coronal suture and that sagittal suture because if you're ever able to look at a skull with a scalp peeled back, you're going to see that there is a beautiful thick scar of myofascial tissue that is webbed, that allows the skull to expand and retract. It has a give and movement. This allows for when you fall and bump your head, you're not going to immediately receive that crack. You're going to feel that, oh, that extreme, intense pain. But those sutures allow for impact absorption. It also